Welcome to our next session, and this is session 4 and it's part 2 of cardiovascular nursing skills. It's a continuation of session 3 and it deals with nursing clinical skills relating to the cardiovascular system. 3 topics: cardiac catheterization, cardiopulmonary resuscitation, and angiography are discussed. But remember that in lesson 337, we showed a video and then we also had a session on cardiopulmonary resuscitation. So our first topic is cardiac catheterization. We'll also be looking at the second one, which is angiography. But angiography and cardiac catheterization go hand in hand. Cardiopulmonary resuscitation, remember, was treated. We also showed you a video on that in NURS 337. So I refer you to watch the video and then revise the cardiopulmonary resuscitation. Now, what is cardiac catheterization? Cardiac catheterization is an invasive diagnostic procedure in which a radio-opaque arterial and venous catheters are introduced into selected blood vessels of the right and left sides of the heart. This catheter is thin and hollow and is most often inserted from the groin or the arm, as you can see in the picture. So this picture is showing, as you can see, to your left hand side we have the catheter entrance, and that is the femoral vein lowered over there, or it can also be introduced through the arm. And then we have the catheter entering the superior vena cava. We also have a site there where the catheter can be introduced, and many other sites, as you can see in the picture. Okay, so that is a picture of how the cardiac catheter looks like. Now let's look at reasons or indications for cardiac catheterization. It's mostly done to get information about the heart and its blood vessels, and it may also be used or done to treat some types of heart condition or find out if a patient or a person needs surgery. It's done in coronary artery disease, people with problems with heart valves, congenital heart defects, and then pulmonary artery wedge pressure. It's also done to assess coronary artery patency, open a narrowed heart valve, and then measure the pressure in the heart chambers. Now, this procedure is contraindicated in any procedure that is associated with some degree of risk if the information derived from it will be of no benefit to the patient. Normally, patients with hypertension it's also contraindicated in these patients as severe uncontrolled hypertension, ventricular arrhythmias, acute stroke, severe anemia, and then those with active gastrointestinal bleeding, and then people who are allergic to radiographic contrast, mostly people who are allergic to iodine-based substances, and seafoods are often allergic to contrast dyes, and therefore the procedure is contraindicated. It cannot also be done in acute renal failure, severe coagulopathy, uncontrolled high blood pressure, ventricular dysrhythmias, and then people with acute renal failure. Now let's look at the procedure. The procedure is carried out by the doctor, but the nurse has certain responsibilities. Before the procedure, the cardiologist explains the procedure, but the nurse reinforces whatever the cardiologist has said. Then special attention is given to patients with insulin-dependent diabetes and then renal insufficiencies. Now, the equipment. There's a need for numerous items of disposable equipment, and these include catheters, needles, syringes, introducer shafts, stopcocks. And then frequently a type of catheter known as the Swan-Ganz catheter is used for carrying out the procedure. Now the procedure. The catheter is passed through the femoral artery to the external iliac artery, common iliac artery. So the catheter is long, as you saw in the picture. It then passes through the abdominal aorta, thoracic, descending aorta, aortic arch, and then to the ascending aorta. From here, the heart can then be assessed. In right side catheterization, the right side of the heart can be assessed either through the subclavian vein in the clavicular region or the jugular vein in the neck. The cephalic vein in the arm to the brachiocephalic vein, then to the superior vena cava, which allows for the right side of the heart to be assessed. And again, the Swan-Ganz catheter is used in right catheterization. Then I would now bring in angiography. In angiography, a dye is introduced through cardiac catheterization into the heart chambers for visualization. So I said earlier that cardiac catheterization and angiography are done hand in hand. That is, before a dye is introduced in angiography, a catheter is passed. So the dye may be injected into the blood vessels through a tube, and then the vessel can be visualized on an X-ray or fluoroscopy. Small tools or medications can also be injected to remove blockage in an artery, especially in coronary artery. And an inflated balloon can also be threaded through the vessel and then inflated to enlarge the opening of the vessel. So please note that the cardiac catheterization, with the cardiac catheterization, the catheter goes directly into the heart chambers, but angiography can be done not only in the heart chambers, but then the dye can also be introduced and blood vessels are also visualized for abnormalities such as blockage. So in picture, we have the catheter, then we also have the sites where it is introduced, and then how the procedure is performed. So that is about the parts of the catheter, as you can see in the picture. Now let's look at our nursing responsibility or management. Psychologically, we need to explain the procedure, assess patients' fear and anxiety, and address them. The procedure should be explained, and then we can even show pictures and videos of the procedure to the patient. And then it should be explained to the patient that a mild sedative and a local anesthesia will be given before the procedure. So patients will not actually feel the pain, but then slight pain may be experienced. We also ensure that a consent form is signed. Then still under nursing management, before the procedure, we should ensure that all investigations such as kidney and liver function tests have been done and duly filed. And some medications may be stopped according to doctor's instruction, so the nurse ensures this. And then patients fast 8 to 12 hours before the procedure. Then during the procedure, is the responsibility of the nurse to assist the doctor carry out the procedure. Then patient is positioned by the nurse on a hard flat surface. Then cardiac functioning is also monitored. These include heart rates. And then we also monitor for arrhythmias. Patient is instructed to cough. And then patient is reassured during the procedure to allay anxiety. We keep supporting the patient throughout the procedure. Then after the procedure, we observe for bleeding at the site, apply pressure at the site to prevent excessive bleeding. Then we also observe for pulsation beneath the incision site, check temperature and color of the extremities, as well as other vital signs. We keep on monitoring for dysrhythmias and cardiac function using the cardiac monitor, and then pain is also managed. Now let's look at a few complications. This procedure can result in arrhythmias, irregular rhythm of the heart rate, hemorrhage or bleeding because it involves introduction of a catheter is invasive. Then there may be venous spasms, the veins are thrown into spasms. There may be loss of peripheral pulse, and then contrast-induced nephropathy. The contrast dye becomes poisonous to the kidney, and then it results in complications of the renal system. So we now come to topic 2 of our session, and this is angiography. But remember that when we were discussing cardiac catheterization, we also included angiography. But to buttress whatever was said, angiography is an X-ray movie that is taken while a special fluid called contrast that is visible by X-ray is injected into a cardiac chamber or a major blood vessel. Remember that with cardiac catheterization, we are targeting the heart chambers, even though we are going to pass through major vessels to the heart. Angiography can be done to visualize both the heart chambers or major blood vessels, and this involves introduction of a contrast medium or dye, which is radiopaque, after which an X-ray film or X-ray movies are taken, and it outlines these heart chambers or blood vessels to isolate abnormalities such as blockage, tumors, and stenosis. So in the picture, again, the same as cardiac catheterization, we have the passageways for angiography. So for your reading lists or references, we are referring you to Smelter and Bear, Smelter, Bear, Hinkle, and Shiva, Brunner and Sadan's textbook of medical surgical nursing, the 12th and latest edition by J.P. Lippincott and Williams.